the type to come and cry like on camera, but I just have to get these raw feelings off my chest. Like, I never ever want to go through this in my life ever again. Ever. Like, people are so insensitive, and like, my appointment is today. My anxiety is through the roof. I'm struggling to just breathe, to not have an anxiety attack, and then knowing that I have to fucking go to the appointment alone. Like, this the shit right here that made me be like, I ain't built for this shit. Being pregnant, giving birth, none of it. Like, this is the discouraging part, and nobody should have to feel like this, bro. Like, nobody. It's pitiful as fuck. And it's like, for a person like me, and being in the situation I'm in, this type of shit is not no better for me. Like, it's not any better for my health. Like, of course I'll probably go in there and it'd be like, oh, your pulse is through the fucking roof. Yeah, probably so, because I have anxiety and I can't even fucking calm down. Like, because I'm in here fucking shaking, because halfway I don't trust y'all. The other half, my fucking world was flipped upside down. And then I'm in here by my fucking self. Just throw me to the fucking wolves. Like, this shit's stupid as fuck. I'm here. Anxiety on 10. Yeah, I don't even know what to say. I brought my notebook to ask questions. And hopefully things go well. Hopefully it's good news. But I don't know.
Try squatting, you can try all of the things. In that sense, if none of that has helped you progress, we would recommend Pitocin at that point. That's kind of like our next strategy. Do people take castor oil in the hospital? I don't know, because they don't tell us. Do I have doulas that probably give people castor oil? Absolutely. If that's something that you wanted to do at home, that's totally fine. If you wanted to do it in the hospital, I mean, you could. If you were like, I've tried everything else, I really don't want to try Pitocin, can I just like take 2 tablespoons of castor oil and see what happens? I mean, that's up to you. Most of us are very open to that, if not all of us.
And then what would determine if I needed a cesarean?
So we really only want to do those in an emergency, right? Or if we know that it can be in a controlled environment and we don't want to get to an emergency. So if baby's heart rate is distressed and we have concerns about that, then our goal is to have a safe, controlled delivery instead of waiting until your baby's heart rate is kind of down and we have to go for a stat emergency C-section. There's just a little bit more room for complications in that. So if baby's heart rate is dipping after contractions continuously, or you're having what we call deep variables, so like low heart rates with contractions over and over and over again, that kind of tells us your baby is like, hey, I need a little bit of help in here because I need a little bit of oxygen. So then it gets to the point where the safest thing is for your baby is to have a cesarean.
Okay.
But we don't do them just like if you're ruptured for 24 plus hours, like that's not a thing.
Okay.
We'll let you labor as long as you want and be ruptured for as long as you want, as long as you were healthy and safe and your baby is healthy and safe.
And as far as birthing positions, am I free to like do?
You can do whatever you want.
Okay.
I mean, we prefer not to catch them over the toilet, but we definitely will. They will frown upon a water birth in the bathtub there. But like if you were in the water and like physically could not get out,
Then
I don't know what they're
it
gonna say. But they do frown upon that.
Okay. And as far as like pushing or like crowning, is like warm compress an option?
Absolutely.
Okay.
We have 6 catching midwives, so we do 24/7 call. So there's always a midwife on call and always a physician on call, and we all stay in the hospital. So we work from 7A to 7A, and our physicians work from 6P to 6P. So you may not necessarily ever see a physician. Every once in a while, Dr. Jones specifically will come in a room and just be like, hey, I'm Dr. Jones, this is my face. If you see me, you see me. If you don't, you don't. But everybody else usually kind of like steers clear of the midwife rooms unless they're needed. But they are always very much aware of what's going on. So we are in constant contact with them and communication with them. If we have concerns that we've already talked to you about, we talk to them about it. And then they might come in to consult for that. They are also the ones that do the vacuum assisted deliveries, the forceps assisted deliveries. We only have 2 physicians that actually use forceps. So you have 1 in 8, or 2 in 8 chance that they would be there. And then they really just come in case of an emergency or in case of a consult for a vacuum, forceps, or a C-section. But other than that, if everything is normal and going smoothly, then you will not see them.
Okay.
With being GBS positive, we do recommend that you come to the hospital sooner rather than later for treatment. But again, completely up to you and what you're comfortable with.
So what do you mean by sooner rather than later?
So if your water breaks, we would want you to come to the hospital to start antibiotic treatment.
Gotcha. Like instead of waiting.
Okay. But we definitely have patients who are fully aware of everything, and that's their decision, and they stay home, and that's okay. I've had people be GBS positive and ruptured in triage that wanted to go home, and they went home. So we are happy to let you have as many options as you want. Laboring wise, 311 is usually what we recommend. So every 3 minutes, lasting at least a minute for at least an hour, to come into triage to be evaluated.
Okay.
So unless you are like grunting and pushing and kind of soaked with fluid, you will go through triage first for evaluation. But if you come in pushing, they will try and get you a room as soon as they can.
Okay.
So I'm back home. Very emotional day for me, of course. Cried this morning to the point that I had to lean on somebody. I called my sister and my little sister, because they're only an hour. She's only an hour away, and her boyfriend came and went with me to my appointment or whatever. I will say I definitely feel like I am in good hands. For starters, she was very nice, like when I walked in, and she is a Caucasian woman. And to be completely honest, at first I was kind of like, because just realistically, dealing with someone that is Black was very important to me, especially just because handling people of color is just a little different. It can be a little different when it comes to health. Now, they do have a lot of Black people that work in their practice, but that's neither here nor there. Wonderful attitude, very welcoming. And she just kind of started it off by, just letting me explain my experience. And she just asked about my pulse. Has it always been like that? Did I know the range? We went down through that. And she told me, she was like, just to be honest, you're symptomatic. She's like, you really do need to see a cardiologist. But she said that the only thing about that is she doesn't know that she could get me in with one before I deliver. So I'm like, well, what the heck? And so because I was asking, what's going to be the deciding factor on how we do this? And she was like, we'll monitor you and the baby. But she said, to be quite honest, if we were to refer you to the cardiologist, they would probably have you do like a at-home test for some days. That could take like up to 10 days. And so we don't have that kind of time. So we just kind of basically are going to treat it like a regular patient. And she said that because I'm asymptomatic. And she was like, I could, try to put it for urgent and see if they'll get the referral sooner. But since you don't have any symptoms, they're probably not going to take it serious. Whoop-de-darn-do there, right? But she just started by asking me, what was my birth plan? We went through, all my history and all of that, of course. And so I was hesitant. And I was hesitant because I was like, I would rather ask her questions first and then explain, my stuff. But she was like, you can kind of tell me what your plan was. I know you were doing at home. So what was it that was up there? And then I'll tell you, what we can do, what restrictions we have, and more about the company. To be completely honest, I went through my birth plan. Not one thing up there was something that I couldn't do. She said that I would be monitored wirelessly, and she said that we could do intermittent monitoring. So we're just doing it ever so often, unless something requires for it to be monitored the whole time. So everything is pretty much the same besides the environment. And, it is still crushing. So I don't want y'all to think that I'm like, hey, whatever. But I really appreciated that she was like really open to everything. And even when it came to her inserting, where it was like conflict, for example, I said no vitamin K shot. And she was just like, that was completely fine. No vitamin K and everything, no Hep B. And she's like, well, with a no Hep B, that's typically done in the postpartum level. She's like, so you'll probably have to sign a waiver, but that's completely fine. And with the vitamin K, she did say that that's completely fine too. But she's like, we talked about like vacuums, the vacuum and forceps. And I said, I don't want that. I said, but I would prefer the vacuum before a C-section if that's what y'all needed to do. And she said, well, in that instance, if all else failed and we had to go into a C-section, and I know if we had to do the vacuum at that moment, I would recommend the vitamin K, but it's still up to you whether you choose to do it or not. She's like, that makes it a little different. And she explained it. And I just really appreciated that she allowed me to make informed decisions. And pretty much everything that I was like a no on, they really didn't do anyways. She was like, we don't really do episiotomies. She was like, especially for pushing, the only time we're going to do an episiotomy is if the baby's head is there and with each contraction, his pulse is going lower. She's like, they don't really do C-sections either. And she was talking about skin to skin with that too. She was like, so even at that point, typically, since we do it in like a more controlled environment, you can still do skin to skin. And we're just going to see how this journey goes. I'm shaking. I am still bummed out though, I will be honest, but I can appreciate that I'm in good care, which my midwife said that anyway. She was like, she ain't just gonna drop me off with anybody. So she was like, don't worry, you're fine. He doing a lot right now, so I gotta go.